Hi everyone, this is the Spectator podcast, the January edition, and today we're joined by Max and Nurse Kliner. Thank you for joining us, Nurse Kliner. We're just going to talk about everything surrounding COVID and a lot of, the questions that students may have. Welcome to the podcast.
Thank you for having me.
Welcome, Ms. Kliner.
Thank you, Max.
All right, so first off, our first question for you is, how are you really doing in terms of all of this? How are you handling things personally and
Fine. Thank you for asking. So, personally, the reason I do this job is to keep people safe and take care of people, and if I'm able to be of service and help the community stay together, stay as healthy as possible, that's a win. Feeling good. I have a great team, and the nurses have really stepped up and done an incredible job, as well as the rest of the health services team. Even the therapist, Ms. Dahlia and Ms. Midley, have done an incredible job helping the kitchen staff. Some people from other parts of the school have really pitched in, like Trainer Dave and Ms. Kalis and Mr. Gerber. So it's been a team effort.
Yeah, that's great.
So recently the school has been getting COVID booster shots. And why do you think students should get this shot on top of their normal shot?
So just to be clear, we haven't been giving the shots. It's been through a partner organization, which is Passport Health, which is who we partnered with to give the vaccines when we offered them on campus, both back last spring and also again in the fall. The reason that we are offering them and why I recommend them is because there has been some evidence that immunity wanes over time, and especially with this latest wave, there's good evidence that a third booster, kind of at that 5 to 6 month mark, where immunity starts to wane, will give you a boost of protection. So we're providing it on campus because we have a lot of boarding students who aren't able to easily have their parents take them for booster shots, and also because it's a nice thing to be able to do for our community.
Right. So this question is sort of on top of the booster shots, the school is also having policies forward to a table, and students should have their masks up after eating. So how effective do you think these policies are in terms of stopping the spread of the pandemic? Do you think they're necessary, and do you think students should be following them, but why do you think that students should be following them?
So at a minimum, for this phase of the pandemic, and this is not candidly where I hope that we would be this semester. I think I even wrote in some report that I wrote to somebody, now that COVID is starting to become so first semester we had no COVID on campus, no cases in our community from September 24th to December 16th.
Right.
Which is amazing.
Mm-hmm.
That we knew of, obviously. Now, we've had a large number of cases since mid-December, in the last 6 weeks, and what we're doing is the bare minimum that's responsible, basically. Not only should people be masked, but they should be wearing well-fitting masks over their nose and mouth, at least medical grade like yours, or better, like mine. Part of the reason for that is because there's really good evidence that, sorry, you can edit that out.
You're good, yeah.
Part of the reason for that is that there's really good evidence that high-quality masks, when worn, help mitigate some of the risk of sitting together closely, within 6 feet or less like we are. Same thing for eating. Eating, I think we've been especially vigilant about the restrictions because that's the highest risk time. The people that are close contacts, again and again, it's because who then test positive, again and again, it's because they were eating together. Because that's a time that you don't have that added mitigation of a mask.
Yeah, so our next question is, we've recently had a large wave of people get quarantined for COVID, as well as any close contacts. So, under what conditions should a person consider themselves a close contact of their friends?
Great question, and there is just full plug for those of you who process information better written than auditory, or what. There's very, very clear instructions about this on the LFA website, but basically, you would be considered a close contact if you had contact more than 15 minutes, less than 6 feet apart, over a 24-hour period. Regardless of whether you're masked or not, although the risk is lower if you're masked. Any physical contact automatically gets you to that 15 minutes. So if you were hugging or kissing somebody, you're there. And then household contacts are also, and there's a debate about whether we would consider roommates household contacts, although I think there's good evidence that maybe we should, given how many people's roommates have tested positive subsequent to them testing positive.
Right.
Household contacts are a little bit dicier, but so those are the people that would be considered close contacts. Those that need to quarantine would be anyone who is not fully vaccinated, meaning anyone 18 or over that's past that 6-month mark or that 5-month mark and hasn't gotten a booster, or anyone 17 and under who hasn't had 2 doses of a vaccine. And then also anyone unvaccinated. So those people are automatically asked to quarantine for a minimum of 5 days. Anyone unvaccinated quarantines for 10 days no matter what. And then if you are fully vaccinated and or have had COVID in the last 90 days, you do not need to quarantine. Fortunately, quarantining doesn't necessarily mean staying home. If you are in that fully vaccinated group, you can come to school as long as you're asymptomatic and you wear a well-fitting mask over your nose and mouth at all times, and you test on day 5 is highly recommended, not required, but I don't know why you wouldn't.
Right.
I mean, I would.
Yeah.
So.
All right. So the next question is sort of relating back to just quarantining and staying home. So when people aren't feeling well, since online there's many different results of when you look it up, what are some simple ways of identifying whether you have COVID or it's just a cold or a flu? And should students immediately stay home or in their dorms if they're not feeling well?
So the basic medical guidance we have is COVID until proven otherwise. Given the prevalence and the spread and the prevalence in our community nationally, if you're not in that category, and even honestly if you are, you should assume you have COVID unless you get a negative test. If you have any symptoms. So, and the thing about this Omicron variant that we've been seeing is that the symptoms are more mild, right? It's a runny nose, it's a sore throat. Some people do have, low-grade fever for a day or 2 or 3, and then a cough a few days later. But it's not. A lot of people, I think, attribute the symptoms to, I was walking outside and it was cold, so my nose is running, or it was dry in my room, so my throat hurts. It's that vigilance of any symptom, you should isolate, stay home. If you're a day student, come see us and we'll test you and then help you figure out how to safely continue until we get what those results are. Because it's vital for us to break the spread of transmission.
Right.
Adding on to that, as you said, Omicron, the new variant, is more mild in terms of its symptoms to the students.
Especially in vaccinated people, I should say.
In vaccinated people.
Yes.
Okay, yeah, so, adding on to that, in terms of looking towards the future, where do you see the pandemic going? Many people think it will become like the flu, where a yearly shot will be required. Do you think this will be the case?
the flu is not awesome either for high-risk populations. You know, a lot of people get really sick and have a lot of really bad complications from the flu. But I do think that COVID eventually and probably helped along, from what I'm reading, by this huge wave of infections, will become endemic. I don't know what the timeline of that is, but it's gonna happen. All pandemics come to an end, right?
Mm-hmm.
They all end that huge, intense pandemic phase. It's a question of how long and how and through what measures it will happen. And I wish I had a crystal ball to say it's gonna happen this way. I don't think at this point we're gonna vaccinate our way out of it. Unfortunately, like other pandemics have been vaccinated our way out of, like polio or, you know, some others. But I think we will get to a point where we're able to live with it. We're just not quite there yet.
So I guess this question is also related to that last question we asked. It's when masks are going to go away, and that's a question that many students have been asking.
I know.
Because, you know, it's like become the new normal, and like they're already doing those things in like China and like in like other countries with like high levels of pollution. But do you think that masks will go away in like the next year, the next decade? What do you think?
Masks will go away in the next decade.
Next
for
decade.
Sure. And I would be hopeful that, I think it goes along with the last question, right?
Yeah.
When it's endemic and that's not the biggest threat, I think masks will go away. I think probably there are a lot of people that during respiratory virus season, you know, like winter season when flu and other respiratory viruses are prevalent, may continue to wear them. In other countries, like you said, it's not just from pollution, but there's, you know, a little bit more understanding of transmission, and I think that people may choose to continue to wear them during certain times of the year or when flu activity or other activity is high. I think a requirement for masks will not last too much longer.
So you think like restaurants won't like mandate them for continued period of time? Or
I mean, there are
it...
some parts of our country even where masks are not required.
Right.
I don't agree with that from a public health perspective yet, given how easy it is to use masks to mitigate transmission. It's like a no-brainer. With the goal of ending the pandemic. I don't want to do this anymore. So, I think until we're there, they'll stay. And I wish I had a crystal ball to say how long that was, because then I'd play the odds in Vegas and peace out of here.
Right. Yeah. Well, that will be it for this month's podcast. Thank you again very much for joining us, Ms. Kleiner.
Thank you, Ms. Kleiner.
Yeah.
And we hope everyone will stay safe and hopefully not get COVID, but if you do, try to stay home. And yeah, thank you for listening.